All right, hello and welcome. Thank you for joining today's webinar, How to Build Provider and Patient Engagement with Your Care at Home program. Our presenters today are two of our excellent leaders here at Current Health. We have Dr. Adam Wolfberg, our Chief Medical Officer, and Sarah Joyce, our Chief Customer Officer. Adam oversees clinical innovation, research initiatives, and customer adoption of Current Health's Care at Home platform. Prior to Current Health, he served as Chief Medical Officer of Ovia Health and Director of Clinical Effectiveness at Athena Health. Adam is also a trained obstetrician and continues to practice at the Cambridge Health Alliance in Massachusetts. Sarah is responsible for the implementation, support, and the overall success of Current Health's customers. Sarah was formerly the Chief Client Officer at Healthcare Source. She has also served as the VP of Client Experience at both Nant Health and Navinet, and held various leadership roles in services, operations, IT, and marketing at Blue Cross and Blue Shield of Rhode Island. And with that, I will turn it over to Sarah to introduce Current Health.
Thank you so much. Hi, everyone. So I'm just going to spend a few minutes talking about Current Health, and then we'll jump into Care at Home programs and provider and patient engagement. At Current Health, we really aim to be mission control for all delivery outside of the hospital. And we do this by enabling partners to set up effective care at home programs. We entered in the US market in early 2020 and have established many partners, and still growing, with several large US health systems like Baptist and Geisinger, Health First and Mount Sinai. And we're really proud of the work that we've done with the Defense Health Agency and their hospital at home program. We've also been supporting the NHS in the UK in their home care delivery for many, many years. And we support decentralized clinical trials with several pharma companies, including AstraZeneca and Amgen. And while we're proud of the savings our partners realize, and you can see some of that here, what we're most proud of are our activation and adherence numbers and our net promoter score with patients. We want happy partners and customers, but we're really focused on patient engagement, satisfaction, and care. To talk a little bit about end-to-end services that we provide in this space, we really focus on helping healthcare organizations be successful by providing a clear window into patients' conditions in the home and helping our clients build and scale care at home programs. Our platform combines our proprietary monitoring device with other connected devices and patient-reported data. And then we display that patient insight in a user-friendly dashboard, which includes tools for patient engagement, virtual and in-home services. And it's really our goal to help healthcare organizations fill any gaps they have for an end-to-end healthcare at home delivery. We do have some exciting news to share as we kick off this webinar. Just yesterday, we announced our plans to be acquired by Best Buy. We're really, really excited about how this will allow us to support our customers and deliver a richer experience for both patients and providers as more and more healthcare moves into the home. We'll be sharing a lot more over the coming weeks, but please do reach out if you'd like to learn more. And with that, Adam's going to talk to us about care at home programs.
Thanks, Sarah. So during the coronavirus pandemic and since then, we've seen a significant acceleration of care moving from facility-oriented delivery to home-based delivery. And I think the reasons for that are obvious. Health systems needed to expand capacity. Patients wanted to avoid health systems and avoid clinical centers as much as possible. And the opportunities that we took advantage of during the pandemic have led to real innovation as the pandemic begins to subside. And so even at the beginning of this year, more than 70% of health systems had at least dipped their toe into some type of remote care program, and those programs are largely expanding. As I said, it's been driven by patient demand, by a need for capacity, and by a need to innovate as healthcare in the United States and in other countries evolves based on needs. So we'd like to conduct 3 polls during the course of today's webinar, and this is the first one. It's a question to you. Does your organization plan to expand remote care in the course of the next year? So if you just take a minute to select one of these options. We'll give you a few more seconds to vote and then show you the consensus of the group. Great, should we see the results? So you can see here that of the 14 people voting, all but one are either expanding or planning a new program. And I think that reflects the healthcare system in the United States, writ large. So no great shock there. As others have done this, they have encountered significant challenges, perhaps not surprisingly. Healthcare in the home involves not only a shift in the way that medicine is practiced, but it involves the new way of delivering services, the new way of keeping track of patients in terms of monitoring their data and supporting and servicing all of the technology, the services, and the service integrations that are required to seamlessly deliver healthcare in a home setting. Additionally, there's a certain amount of learning, change management even, that's required, working with healthcare administrators, healthcare providers, and of course patients to get them ready and comfortable in this new environment. And that's really what we want to focus on today during the remainder of the webinar. So with that, I'm going to turn it back over to Sarah, who's going to talk about the approach that we recommend toward engaging providers during this process of shifting from the facility-based model of care to the home-based environment.
Thanks, Adam. All right, so let's start by defining what we mean with provider engagement. So it's referrals and admissions of patients who are well suited for a program. It's the virtual engagement with those patients and of those patients, and collecting ideas for improvement from providers of patient care. And all of those things, can be measured in different ways, including number of referrals, number of admissions, logging engagement with patients, with calls and messages, et cetera, and net promoter scores, so willingness to recommend. There are some common challenges with provider engagement. Your providers might be unaware. So what's going on? What are we doing? Why are we doing it? Could be hesitant. I want to see the patient. I want to physically see this patient every day. Maybe resistant to change. So I'm treating the patient successfully. This works. Why can't I continue doing what I'm doing? Could be fatigued. Please don't give me yet one more thing, not one more initiative to work on. Or potentially distrustful. What if the patient deteriorates? What are the patient outcomes? So with that, we want to do our second poll question, thinking of these challenges. What's your biggest concern for provider engagement? And we'll give you a few seconds here to answer this question before we share the results. All right, should we take a look at the results? All right, you can see here that resistance is the winner. So of the 17 people who voted, resistance was the answer most commonly selected here, followed by hesitance and fatigue. All right. So let's start talking a bit about how to build provider engagement. So we think about this as 3 phases with different goals. So the first, planning with the goal of awareness, the second, building with the goal of input and education, and the third, growing with the goal of adoption. So let's talk about phase 1 a bit more. As you're planning your care at home program, there's a couple of initial questions to ask. Who's this for? What are you trying to achieve? What's your goal? There are several milestones that we think about in phase 1. The first is identifying champions and project leaders. So who's sponsoring this and driving this initiative forward? We suggest doing a call for interested clinicians, really need a clinical sponsor for something like this, in addition to a program manager, project manager, who's really important to move your project forward. So somebody to ensure that the work gets done. The second milestone here is identifying the provider audience who you need to buy into this. And with this, we do suggest communicating as early as possible, partnering with your internal communications teams for more assistance in really driving this forward. And the third milestone is defining the goals and thinking about what difference will this program make for our patients, what difference will this program make for our organization. And something to keep in mind as you think about engagement, the organization's purpose for creating the program may or may not work as personal motivation for providers. So ask providers to think creatively about how they could use Care at Home to innovate their practice and create exceptional patient experiences. And actually, next slide, Adam, thank you. Okay, so the second phase is building your program, and we see a few milestones in that as well. Defining your protocols, so how's this going to work? Get specific about your referrals and admission, and think about how you want to handle EHR integration, and if you want to integrate with EHR. Also build or adapt or change clinical pathways for whatever use cases you're targeting. Second milestone here is engaging providers and selecting patients. And we really suggest starting small. So think about 1 or 2 clinical use cases to do those well, and then add from there. Assign ownership to those champions that you identified, and get them thinking about who would do really well in a home care setting. And then the third milestone here is identifying internal and external partners. So what technology and services will be included here? And we also suggest for one of your internal partners, really working with your marketing department for both provider and patient engagement to have a really strong communication plan, marketing plan around all of this. And then the third phase, growing your program, which is our last phase here, has 4 different milestones that we've identified. The first is how do you market internally? So looking at what impact the program is having and how do you communicate that using multi-channels, making it a very kind of human connection and creative to draw attention to what's going on. The second milestone is about measurement. So how is your program tracking to your established goals? And also, as you grow and evolve your program, identifying new goals and milestones to track here as well. And then also, it's not just about tracking how well you're doing against goals, but tracking challenges along the way and identifying those and creating actionable plans to address those challenges as they arise. And then the third milestone, ongoing storytelling. So continue to ask, what is our story internally, as this will continue to evolve as you grow your program as well. And then the last milestone here that we suggests daily huddles or some sort of like daily check-in, checkpoint with your folks internally. What are you hearing from patients? Make sure you include these stories in regular meetings and your department communications with the internal project team. So the team's really connecting to the outcomes that patients are seeing. So that's really how we think about provider engagement. And Adam's going to now tell us how we think about patient engagement.
Thanks so much, Sarah. So the other aspect of engagement is making sure that the patients are engaged not only with the program, but really more importantly with their health and well-being. And to the extent that you make the patient your ally in their own care is the extent to which the program will be successful. So we believe it always begins with measurement. So how do you drive patient engagement? What are the metrics that are useful in determining whether you are achieving engagement, and how do you think about whether there are opportunities to improve? So the first one we think about is activation. That is, when you give the patient a set of monitoring technology or a set of services for that matter, are they using it? Do they turn it on in the first place? Do they set it up correctly? And are they able to stream the data? Are they able to use the service that you're providing them with? If the patient doesn't activate, nothing else really matters. So we spend a lot of time working with our partners to talk about how they can ensure activation by working with their patients to understand why it's so important that this service or this piece of technology is part of their healthcare, part of what's recommended by their healthcare provider, and part of what will help them to remain healthy, to get better, and to stay out of a hospital if that is their objective. The second broad category of metrics that we think about is the concept of adherence. Once the patient's set up on the device, receiving the service, are they using it day in, day out, overnight, whenever they're supposed to be accessing the technology, streaming data, in the case of current health monitoring technology? Are they doing it when they're supposed to? Are they answering the questions that are asked of them in terms of providing the subjective feedback that is so important in terms of understanding how they're feeling about their health and their well-being? And then lastly, adoption. Have they come to adopt this technology as part of their healthcare? And are they satisfied with it? Do they see it as important? Do they see it as a service that is useful to them? We're very interested, of course, in measuring not only our clients' satisfaction with the program, but in some respects, more importantly, our clients' patient satisfaction with the program. So let me pause here for a second for our last poll question. Which of these stages, in terms of achieving adherence from a patient perspective, has been the biggest challenge for you so far? For those of you who have been in the thick of implementing these out-of-hospital, home-based care programs. And just give another second to choose one of these three options, and then we'll get to the answers and continue on. So should we look at the answers? It looks like a pretty even split here, but adoption, that is growing the program, has been perhaps the biggest challenge for half of those responding. But I think that what we see from this poll is that each of these issues represents something that's important in terms of a program success, and that by addressing activation, adherence, and adoption, the program is most likely to be successful. So when we think about adherence, it can be tricky to measure, and it really depends on the technology or the service that we're trying to make successful. So for example, the Current Health Vital Sign wearable device is a continuous vital sign monitor. And so our expectation is that patients will wear that really around the clock in order for their healthcare provider to have insight into their trending vital signs and be able to anticipate when things may go wrong before they actually do. And so our benchmark is 90% adherence. We would like to see patients meeting a 90% adherence rate, wearing it 90% of the time. And that's our expectation and our standard. And we work with our clients to meet that standard. On the other hand, blood pressure is not measured continuously. It's measured on a regular basis. And depending on the clinical condition that we're concerned about, it might be 3 times a day, it might be 6 times a day. It really depends. Weight is typically measured daily in the morning. And so we work with our clients' patients to remind them to take it at the same time every day under the same circumstances. And the other intermittent vital sign monitors that are important to understanding the overall well-being of a patient need to be measured at the right time. And we use a variety of different patient engagement tactics to help our clients make sure that they're getting the data that they need when they need it. And then lastly, survey completion is just so important. Patients have an opportunity to respond using validated survey questions on a tablet in their home. And by doing that, they engage in their healthcare and provide that sort of subjective information that's so useful to their healthcare provider, but honestly, also to them as they see their answers change over time. So depending on the service or technology involved, the metric of adherence is just a little bit different. Then when we think about driving it, how do we do it? You know, technology has its advantages, but also its challenges. And so we want to make the technology really easy to understand and use it, take advantage of it to help patients remember to measure their vital signs, to answer a questionnaire, to take their medication, to keep a virtual appointment with their healthcare provider, or simply to get up and move around. Technology offers incredible opportunities to sort of be an automated part of the healthcare experience. At the same time, though, it needs to fit in the context of program design. So are we collectively with our partners developing programs that are designed to be easily accessible, to be easy to understand, to be rewarding to follow? The journey itself is as important as anything else. And so working to develop a journey that is cohesive and easily followed is absolutely critical. And our clinical team has a lot of experience in designing journeys that work for patients and for their healthcare providers. Obviously, when it comes to any healthcare service, communication is everything. And so developing the content, the cadence, the tone of education to help patients understand not only what they are expected to do, but why they need to do it in order to advance their own healthcare is critical. And we think that there are great opportunities at developing effective communication strategies that can really advance a program and make the difference between success and lack of success. And then tailored education, making sure that communication is part of an educational program that makes the patient wiser and more engaged in their own healthcare, so that as they've spent time with your program, with your team, and with the technology you've deployed, they end up being more informed about their healthcare and hence more engaged in improving their health status. The strategy depends a little bit on where you are in the program. And so, for example, the strategy that you're going to take with some of these tactics as you're building the program to begin with, or even to planning the program before you actually build it out, may be more basic and may be more dependent on the existing content in that comes from a program such as the current health technology and associated services. Then, as the program becomes more sophisticated and gets to the point of growing and scaling, the opportunity to engage in multi-channel marketing, both within your organization and outside of it, becomes more robust, and you can expand and add nuance to the different engagement strategies as you work with different audiences, both among your patient population and your provider population, and developing really clinically focused educational and communication campaigns that address the right population with the right content can be particularly effective. And I'll give you an example of an experience that one of our partners had as they learned how to engage their patient population. what they had decided initially was that for some of their patients who were admitted into a home-based care program without ever coming into the facility, that they would ship the remote monitoring technology directly to the patient in essentially a unmarked box, and then talk the patient through activating the technology. This is monitoring technology. It turned out that frequently the person answering the door when the delivery truck arrived wasn't necessarily the patient and didn't recognize that this box contained technology that was really important to advancing their loved one's care. And so we got much tighter with our client in terms of providing that monitoring technology in a direct face-to-face handoff. If it did in fact need to be shipped, it was shipped in a box that was labeled with our client's branding. We helped them to reach out to the patient and explain really carefully what was arriving, why it was important, and troubleshoot any issues that they had a day or two after it arrived. And what had begun as a program with modest activation turned into one that was incredibly successful from a clinical perspective, from a cost savings perspective, and really most importantly, from a patient satisfaction perspective, as the client became more sophisticated and started to use these different tactics. So there are lots of strategies that can improve patient engagement over time. And when engagement reaches a higher level, when we're more successful in engaging the patient, ultimately, we're more successful as clinicians. The clinical outcomes are better, the cost reductions are more easily realized, and the program's general satisfaction among your colleagues and among your patients ends up receiving higher scores. So it's almost like a triple win. So with that, I think Sarah and I are going to wrap up. If you have any questions, please put them in the chat. We will make sure to get answers out to you. If you have questions about current health, by all means, let us know. We'd love to talk. And if we can be helpful to you as you think about developing a really successful program where you can take care of your patients in the home, by all means, let us know. We'd love to be helpful in any way we can. So thank you so much for spending half an hour with us today. And we look forward to having a chance to talk one-on-one in the future.